There's no end in sight for the vaccination shortage and crisis still ongoing here in Japan. Overly restricted doctor-only laws, vaccine registration system flaws, and a bureaucracy that resists quick change. In today's video, I will share the latest Japan COVID vaccine news and the Japan COVID response. Lots to talk about, so let's get going. Hi, I'm Mike Matsuno, the man in Japan, and I'm here in sunny Kyoto. Although we're in the rainy season today is beautiful and the rice planting has just begun. On this channel, I share videos about daily life in Japan. If you like the video, please hit that like button. And if you want to hear more about what's going on in Japan, please subscribe. Here are the highlights of the Japan COVID update. First, as of today, 10 prefectures in Japan are now on a state of emergency list, with Okinawa just joining the list today. Second, although the vaccinations for frontline medical workers began on February 12th, 4 months later, only 46% of Japanese medical workers have completed the full vaccination. The good news is that is quite a big jump from 9% 3 weeks ago. Third, in all of Japan, only 1.5% of all Japanese have been fully vaccinated. On the bright side, that was 0.7% 3 weeks ago. Fourth, Japan had only approved one vaccine that they were using, Pfizer. But just this past week, the Japanese government approved 2 more vaccines, Moderna and AstraZeneca. So although things are still very slow and of course could be and should be much better, there are some positive signs of improvement in Japan. The latest big issue is back in February and March, the stock and lack of supply of vaccines were the primary problem. However, that is no longer the issue. The present problem is there are not enough doctors and trained or qualified nurses to administer the vaccinations. As I have talked about in my first 2 Japan COVID update videos, Japan has a law that stipulates that all vaccine injections for patients must be given by medical doctor or trained qualified nurse. Now, I'm not a doctor, but in my layman's observations, it does not seem necessary that only a medical doctor is capable to administer a vaccine injection to a patient. I believe that anyone who is trained to give injections could do so, and of course you would have medical doctors on standby in the area in the case of any adverse reactions, but you would not have to have every single vaccine administered by a doctor or a specially trained nurse. I'm curious, in the comments below, can you write if in your country only doctors and qualified nurses are allowed to administer vaccines? And if not, who else is allowed to give vaccinations? If you could, in the comments below. I've asked many Japanese why this law exists in Japan, but no one can answer the question. Just last week on an NHK documentary, Dr. Kutsuno, an expert in infectious diseases, made the same recommendation that pharmacists should also be approved to give the vaccine. I even asked my pharmacist here in Kyoto about what he thinks about the vaccine system in the US where pharmacists can give the vaccinations. He agreed and said yes, that he would like to be able to administer vaccines here in Japan. Recently, the government just approved dentists to be able to give the COVID vaccinations. At first, I was kind of surprised. I thought, why would you ask dentists to give vaccines? The reason given by the Japanese government was that dentists have been trained to give shots into patients' mouths, so they know how to administer injections. So I guess that is logical, although some may argue that injection into the mouth and into a muscle is quite different. But nonetheless, that's great news, and that more medical professionals can administer the vaccines here in Japan. To me, this only doctor law for vaccination seems somewhat strange, and it sounds like a monopoly where maybe a doctor's lobby or union somehow may want to retain control to administer injections, possibly for financial reasons or other reasons that we don't know about, because I cannot see any logical reason why the law stipulates that only a medical doctor can administer vaccines while more Japanese are getting sick and dying every day because there are not enough doctors to give the vaccinations. Even last Friday evening on NHK News, Taro Kono, who was appointed and is in charge of the rollout of the vaccines, he suggested that pharmacists should be also approved to give vaccinations. But then later, the health minister, Tamura-san, indirectly stalled that suggestion. Mr. Tamura's response was a typical politician or bureaucrat response. Minister Tamura said they will have to study or look into this matter, kento itashimasu in Japanese, which usually means that they will not do anything for the time being. Shouldn't Mr. Tamura realize as health minister that it is a cold red in Japan? The house is on fire. We should not have to take or waste any more time to study whether the pharmacists should be able to give vaccines or not. and the two of them are head ministers who are two of the most powerful people in Japan. They should be able to direct the changing of the law or to make an exception for this pandemic. So there's also politics and posturing between ministers and the different ministries going on. It reverts back again to what I have said in previous videos. Where there is no precedent, Japan many times stalls and ends up either tripping over its own 2 feet or otherwise ignores or avoids resolving the issue until it is too late. 75% of Japanese are not satisfied with the Japanese government's rollout of the vaccines. Most people feel the rollout has been way too slow with a lot of administrative problems. Taro Kono, who was appointed to be in charge by Prime Minister Suga in January 2021, has seemed to struggle within the ministries and bureaucracies of Japan. However, he is one of the few politicians who really understand what Japan needs to do and how it has to change. He was educated in the US and holds a degree from Georgetown University, so he is one of the few in the Japanese leadership who can understand the necessity of quick action. Recently, Taro Kono is speaking his mind more and more. In Japan, most politicians who are in the power faction, like the present LDP, will not normally criticize the Japanese government's rules, laws, processes. But recently, you could feel Kono-san's frustration. He said, even though we are in a state of crisis, we're still using the same rules to approve vaccines that we do under normal times. He added, in the wake of this corona situation, the administration needs to change. He was sending a strong message to the health ministry, where Mr. Tamura is the minister, and also the Pharmaceuticals and Medical Devices Agency, which is Japan's main drug regulator. In the US, a recent report showed that various levels of governments were expanding on who could give vaccinations. And the list included authorizing community health workers, retired professionals, health professional students, pharmacists, dentists, and veterinarians to administer the COVID-19 vaccine. Japan does not have to be as open and progressive as the United States, but they could approve at least pharmacists and some medical health technicians to give the vaccines. There are a lot of pharmacies and pharmacists in Japan that would really help to jumpstart their vaccination efforts if they were allowed to administer the vaccines. On May 24th, this coming Monday, tomorrow, the national government's rollout will start. The self-defense forces will be staffing these vaccinations in Tokyo and Osaka. They are hoping they can reach the maximum number of vaccinations in the near future of 15,000 vaccinations per day. However, there are still many administrative and online problems with the registration and getting appointments that the Self-Defense Force Administration has still not resolved. Another big problem is that the national vaccine rollout and the prefectural government vaccine rollout are not synced or not connected at all, meaning that the two systems run parallel to each other. So it's not possible to know if someone has already been vaccinated on the other vaccine system, because the other system is completely separate. So if you sign up for the prefectural city local government vaccination, there's no way to track a person if they were already vaccinated on the national vaccine network, or vice versa. As you can imagine, for many elder senior citizens, this can be very confusing. There are 2 vaccination systems. There are 3 approved vaccines. There are 2 shots to be given. There are different ways to sign up for each vaccine, and there are separate locations for national and prefectural city vaccination. Some senior citizens could possibly sign up for both national and prefectural, or they may go to a different location for the second shot. There are so many possibilities of a miss happening. These types of administrative gaps have made it extremely difficult for any kind of careful planning. There are still so many moving parts, and at this time, no one really is able to connect all the dots. Things have improved greatly in percentage points, but that is only because Japan had so few vaccinations completed that at the start, going from 0.7% to 1.5% is double and sounds big, but in actual numbers is still very small. So all we can hope for is the Japanese to gradually start doing what they have done well in the past, to create efficient and smooth running and working systems that will bring about concrete results. So keep your fingers crossed. If you like this video, please hit that like button and subscribe so you won't miss the next update in Japan. Catch you on the backside.